Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
Hello, everyone, and welcome to 5 to Thrive Live. I'm Karolyn Gazella, and I co-host this show with my good friend, Dr. Lise Ullschuler. Today, our topic is guided imagery and positive affirmations, which I have used in my own healing journey. So this topic is near and dear to me. And I have the perfect expert to discuss this topic. Dr. Jen Green is not only one of my favorite naturopathic oncologists that I have known for many years, she is also a cancer survivor and the creator of BeLoved Guided Imagery for Cancer. She is also the research director for knowOncology.org, the Knowledge in Integrative Oncology website, and a clinician with MCura Integrative Clinic. But before we dive in, I'd like to thank our sponsors, beginning with Cetria, a patented form of glutathione clinically proven to raise blood glutathione levels. Glutathione is the master antioxidant and the body's primary defense against free radicals. It also helps support respiratory health. For more information, visit cetriaglutathione.com. Also, Cognizin Citicoline, which is nature's way of keeping the brain's energy-producing centers firing on all cylinders. If you're looking for a way to enhance your brain function, including memory, focus, and attention, look for Cognizin on the label or go to cognizin.com for more information. ProThriver's Wellness Brain is a product that contains Cognizin as well as other brain-supporting nutrients and herbs. You can find ProThriver's Wellness Brain online at pureformulas.com. There's also ProThriver's Wellness Sleep, which combines higher dose melatonin and other sleep-supporting natural ingredients specifically designed for thrivers. You can find ProThriver's Wellness Sleep also at pureformulas.com. And Dr. Ohhira's Probiotics, it's a best-selling probiotic for more than 30 years. It contains 12 probiotic strains that are shelf-stable, so no refrigeration is required because of a unique 3-year fermentation process. It's a very effective probiotic. Learn more at drohhiraprobiotics.com. Dr. Green, welcome, and thank you for joining me.
Thank you so much for having me, Karolyn.
I know it's been a while, but I'm so excited about this topic, and I know you are too. But let's start with the basics. Yeah. What is guided imagery?
So guided imagery is an audio track. So it's listening to words that are guiding you through an experience, almost always beginning with a relaxation section. So bringing ourselves into the relaxation response, either using the breath or using progressive muscle relaxation or a combination of both. And then, instead of imagining the worst possible outcomes, which is what our anxiety brain does, it's imagining the best possible outcomes, the outcomes that we're looking to achieve. So it's harnessing the power of the unconscious. It's bringing into alignment our unconscious and our conscious mind to direct ourselves where we want to go.
Yeah, and we're also going to be, that's a great explanation, by the way. And we're also going to be talking about affirmations. So yeah. Speak a little bit about that. What are affirmations?
Yeah, so affirmations are adjacent or similar to guided imagery. In guided imagery, the language is you language. So you picture yourself walking down a set of stairs with each step, that kind of language. Whereas with affirmations, it's I statements. So I am capable of facing the challenges ahead of me, those kinds of statements. Another key difference between affirmations and guided imagery is affirmations won't put you into a semi-hypnotic state first. So you can listen to them while you're driving or while you're, cooking dinner or doing other things. You can just have them playing passively in the background so that your unconscious is hearing them. And you don't need to even pay it much mind, to be honest. Although you can also listen to affirmations and repeat it in your own mind to strengthen that message. Whereas with guided imagery, you don't want to do that when you're driving. You don't want to put yourself in a semi-hypnotic state when your attention needs to be somewhere specific.
Absolutely. I would agree. Is guided imagery a form of meditation?
It's a separate category, but I would say it's a little more accessible than general meditation. So emptying the mind is not always an easy task, whereas giving the mind somewhere to focus, especially in a positive direction, is, I find, often more accessible for people, which is why I bothered to record an album for guided imagery. Not that meditation isn't incredibly valuable, but it's really a separate skill. And when you're dealing either with a new diagnosis or in the thick of treatment and whatnot, the sort of stresses of cancer, it is hard to learn a brand new skill like meditation. If you had a previous meditation practice, absolutely, but it can be a little bit tricky to learn a whole new skill. Whereas guided imagery, I think of as a little bit lower hanging fruit because it's more accessible to people. It's easier to kind of pop in and pop out and get sort of immediate benefit from it and not get perhaps, there aren't the stumbling blocks that there are with meditation. Let's say that.
Yeah, I would agree with you. And I love the word accessible. When I was healing, I did guided imagery first, and then I did move into meditation. So I would agree. I think guided imagery is a little bit easier, as you mentioned. Now, as a physician
Mm,
and a naturopathic oncologist, why are you so passionate about this specific healing tool? What interests you
yes.
the most about guided imagery?
Yeah, that is a great question. The reason why it sort of pops up to the top of the pile for me, because there are many mind-body interventions, is a few factors. The accessibility, I'll return to that. So it's free or almost free. I mean, my album is free and lots of other ones are free. So I would say that's very accessible to cancer patients. There's no financial burden. It is unlikely to do harm. We'd have to work really hard to try and find a harm. Obviously, you want to be mindful that the messages you're giving yourself are messages you agree with. But other than that, you don't have a risk of harm or interact with medication or that sort of thing. And it's bringing you the last piece I would say is it's bringing you in a closer relationship with yourself. It's strengthening this alliance that you have with your own belief system, your own internal resources. It strengthens my experience anyways of doing guided imagery myself. It's just that it strengthened me in ways that I didn't expect it to. It was more effective than I thought it would be in the cancer process. And, we're speaking of no oncology, we're always trying to match the level of evidence to the level of risk. So in other words, and Dr. Donald Abrams, the integrative oncologist, has pioneered this in an article he has hosted on Cancer Choices, which is a wonderful website. And he talks about how the level of risk should equal the level of evidence. And with guided imagery, the risk is so low. How much evidence do we even really need? And yet there are 7 randomized control trials in cancer patients showing that guided imagery, all well-constructed studies showing that guided imagery really impacts anxiety and depression in cancer patients. And then some of the more recent trials have shown that it also helps with chemotherapy-induced nausea and vomiting. It improves health-related quality of life, which is sort of the big picture outcome that we look at in populations. And these really tangible improvements in mood, in anxiety and depression, are valuable in and of themselves, Karolyn, but also, one of the things I don't think we talk about enough of, or is a gap in our cancer care, is addressing distress in people living with cancer and newly diagnosed and all of the above. Because it also affects our immune system, our inflammation. Anxiety and depression are not good for our health. And we know that, and we know that it's going to impact cancer outcomes as well. So to me, guided imagery is just the lowest hanging fruit. Why would we not include this in part of our routine care? Because we have strong evidence that it is effective. There isn't a risk to the patient to do it. There isn't a financial burden. And it's helping to address this really unmet need of helping support people emotionally through a very distressing time.
Yeah, and I'm so glad that you're talking about the science, because I know that you're very much a science person and
Mhm.
evidence is important. I mean, 7 randomized clinical trials, that's the gold standard. So that's surprising.
Yeah.
But do we know how it works? Like oftentimes when we look at these studies, we want to look at mechanisms of action and we want to understand how it works. Do we know that about guided imagery, or do we just know that it works?
Yeah, a little bit of both. So guided imagery, because it incorporates a relaxation aspect, we know it's going to impact our physiology to calm our nervous system. So we know that it reduces cortisol, for example, which is, our chronic stress hormone that is definitely a goal of most of ours to reduce our cortisol levels. But then it gets, so there's broad effects that you can assume of all guided imagery. But what's interesting is to look at some of the research, for example, on the effect on the immune system and how this was a breast cancer trial. Women who vividly could picture their natural killer cells actually had higher levels of natural killer cells in the blood, measurably, and higher levels of natural killer cell activity. So you can actually strive for a specific health outcome. And by rehearsing it in our minds and by picturing it very vividly, because our imaginations are powerful, we can impact our physiology in these very specific ways.
Yeah, so it has physical benefits. It's interesting because when I was recovering from my ovarian cancer, I had a friend who was a runner,
Mhm.
and she told me, I think about you every time I run, and I
Mhm.
visualize that with every step, my
Mhm.
foot is crushing your cancer cells.
Oh, wow.
Yeah, I thought,
I
wow,
love
now
that.
that's a good friend. But this is
Mm.
how as you mentioned, our imagination and how guided imagery works. Can you describe one of your favorite guided imagery tracks that you created? Can you take us through what is it like?
Yeah, I mean, actually, my favorite one, I didn't even, I'm not in love with the title, and I love the track because I never would have thought of it if I hadn't gone through cancer myself. So the track is called Receiving Spiritual Healing. But what it's really about, and it starts with broader healing, connecting with nature, receiving healing from there, connecting with, moving up to higher levels of energy and into the spiritual realm to receive healing. But one realizes that you've got a team of people praying for you, exactly like your friend with crushing cancer. These people are directing uh, thoughts, sometimes even on a daily basis, dedicated towards your healing. And so we don't often pause to receive those prayers, to
Mm.
receive those. Yeah. So that guided imagery is about creating space, 14 minutes in the day or in the week to take a moment to really take in all of the love and spiritual healing that is being directed to you in this distressing time, and that we can sort of complete the circuit is how I think of it. By actually taking time to soak in the energy that's being sent your way to get the full benefit of it.
I love that. And you know what popped into my head when you were talking about that?
Yeah.
It also encourages this sense of gratitude. Like you're thinking about all these people who are, you're opening up to receive their healing energy and it makes me feel such gratitude that you are open to that and receiving that. And I love it. And I'm glad that you mentioned the length. So typically, so this one is 14 minutes.
Yeah.
Typically, how long are they?
I mean, mine, I kept all around the 15-minute mark. The sleep one is maybe 19 minutes, but that's mostly because it has a very slow fade out with the music. I did it over theta wave music to sort of, again, encourage that hypnotic state. I love theta music.
Yeah, me too.
But I deliberately kept the visualization short because our attention span is not super long when we're going through treatment. So there's a track for surgery, there's a track for chemotherapy, there's a track for radiation. There's a sleep one. The sleep one actually is the only one that doesn't have any mention of cancer. There's a series of affirmations, and the affirmations are connected. There is a focus on self-compassion in affirmations, but the affirmations are also connected to an article I had written on managing mindset in cancer, which looks at different parts of ourselves that come to bear, like the warrior or the stoic, these different aspects or ways of coping. Or parts of ourselves. And so the affirmations, you don't really notice it consciously when you're going through it, but the affirmations call upon different strengths within us and different mindsets connected to cancer. So yeah, that's sort of happening on the background of the affirmations track, is because some people are more in the warrior mindset and some people are more in the stoic, or some in the mindfulness mindset, or some more in a spiritual mindset. Or then there's one I call the ER doc mindset, which is very practical and sort of focused on problem solving. So all these different parts of us can come to bear. And so the affirmations deliberately use language to speak to people who are coping in different ways.
Yeah, so give us an example of what some of the affirmations are.
Oh, great question. I should pull that up. Let me pull that up on my documents because I can't actually remember.
No, I know.
But I'll get it in a second.
Yeah, because I do want to talk about the BeLoved Guided Imagery. And while you're pulling that up, why did you name it that?
Oh, beloved.
Beloved, yes. Oh, that makes sense.
So it's a combination of beloved and beloved. So I don't know how it came to me, but I think one of the many lessons that I got out of going through cancer was that being is enough, that we are inherently worthy, and that being loved is part of why we're here. You know, I always thought of myself as being here to love others, but I didn't get that it was also my job to be loved and to receive love and support from community through a hard time like this. So that's sort of where the title of the album came from.
Yeah, I love that.
Yeah. Okay. I've got some affirmations. So
cool.
Some examples are: I embrace myself wholeheartedly and dedicate myself to being a kind and gentle friend to myself along this healing journey. I am capable, strong, and naturally resilient. I can handle whatever comes my way.
That's a great one.
I call upon my intention to heal my physical body, my emotional body, and my spiritual body. I engage my powerful will to assist me in doing this. And then I'm going to find one of my favorites. I don't know why I love it so much, but when I listen to this myself, this is always one of my favorites. Like gathering flowers in a meadow, I gather loving kindness and self-compassion and place them in my body, feeling them fill my arms and legs, my belly, chest, and head. Very good.
Yeah, I love that. And the reason I love that one is because it also adds in such a wonderful visual. You know, so it's not only a really positive affirmation, but I'm a flower girl, love flowers. So yes, that is great. Okay, so what advice do you have for people who've never tried guided imagery?
That there is no skill required, that even though people will differ a little bit in how richly they imagine. So there is, some people are natural writers and whatnot. That the same thing that happens with anxiety, which is imagining something scary, is a wonderful skill we can harness for our well-being, which is imagining ourselves strong and resilient and capable and well equipped. Really, that whether you're a child or whether you're adult, guided imagery is easy to slip on because thankfully as humans, we are naturally imaginative beings.
Yeah, we really are. And this takes advantage of that natural skill that we have.
Yeah, you had brought up sports before, and I mean pretty much all of the professional level sports people engage in some form of guided imagery as preparation. They rehearse in their minds, and actually they've done interesting studies on the brain and what areas light up. And when people, let's say a professional basketball player is visualizing a game and visualizing what's happening, even though their body isn't moving, the parts in their brain are lighting up connected to that. So that there is, again, real activation happening in the body, real immune activation or real preparation for surgery when we visualize these things happening. And it's not just a tool that professional athletes use, it's a tool that all of us can use.
Yeah, absolutely. And back to my friend who was jogging and visualizing my cancer cells. Do you
Mhm.
encourage caregivers and family members to participate and join in and do guided imagery with their loved one?
Oh, thank you so much for saying that, because I will say I do think guided imagery is a wonderful way to protect against caregiver burnout, which is a very real and yeah, and sucky thing to
Yeah,
experience
yeah.
for anyone who's experienced it, and just like your life force kind of getting drained out. So absolutely, because part of the challenge when you're a caregiver is it's very tempting to throw away self-care and prioritize another person's needs first. And so carving out even something small like 14 minutes is a way to yeah, be in allegiance with oneself, or to be in that self-care mode where some of the energy is cycling into you rather than out of you. And there are, I mean, there are a ton of amazing guided imageries out there. I'm pretty sure that Belruth Naparstack has a guided imagery specifically for caregiver burnout. And I know that I had many years ago for one of the conferences, ONC-AMP conferences, I had hired Gail Evo Petriculo, does customized guided imagery here in Michigan, to do a caregiver burnout prevention guided imagery for naturopathic doctors working in oncology. So yeah, I think there are just such broad applications. We're really at the tip of the iceberg with the potential of guided imagery. I'm pretty sure in one of your previous episodes, Karolyn, you talked about that guided imagery study for surgery, for breast cancer surgery, where they actually saved, it was, I think, $740 for every in surgical time for every woman who did guided imagery in preparation. It was a self-hypnosis study. That's what it was. They did self-hypnosis right before surgery, and the healthcare system saves so much money per person. Not to mention the benefits of lowering cortisol and helping the person experience less stress before their surgery.
Yeah, I can see a lot of applications, and I'm so glad that you brought up caregiver burnout, because I've been on both sides of that equation. I've been a cancer patient, and I've also been a caregiver, and I can tell you that being a caregiver was far more challenging. I mean, it's one of the most stressful things that a person can go through. So this is a
Yes.
great tool. Um, BeLoved or BeLoved Guided Imagery. I mean, truly, it's a gift, Dr. Green, and the fact that you're making it available free of charge, it's very accessible. So where can people find more about a BeLoved Guided Imagery? And you had mentioned that it's free. Where can they find it?
Yeah, great. It is. So it's on Amazon Music. It's on YouTube. It's also on Spotify. And then there's a sort of landing page on a website, belovedcancersupport.com/guided imagery. But whatever system people are on, Spotify or YouTube or Amazon, they can also search Dr. Jen Green, or you can search BeLoved Guided Imagery for Cancer, and either of those will bring it right up. And the logo is sort of purplish, and there's an image of mountains that my daughter had created. It was a whole family affair.
Nice. I would imagine that creating something like this was quite healing for yourself as well, because it is a gift. You've created something quite special. So for your own personal journey, how did that feel?
Yeah, I mean, so I recorded an early version of the affirmations to listen to every day during chemo radiation. And so I had a chance to sort of listen and refine over time. And then because I had head and neck cancer, my voice was very affected by treatment for a time. And so when I finally got to get in the studio a few months later and record it, it was deeply healing on many levels, to use my voice, and also it was such a wonderful, magical day in the recording studio. It was, I was in a very hypnotic state because I was listening to this theta wave music and doing all of these recordings, and the team that I worked with was so, just beyond wonderful. And there's a lot of energy that gets captured in the voice and in music and in recording that I hadn't really appreciated before that experience. And that's something that you do on this podcast, that there's so much that gets communicated about your mood and your smile and your loving nature and the desire to help. All of that is also getting communicated in your words on this podcast. So yeah, just to acknowledge that, and thank you also for the powerful work that you're doing in supporting people on their cancer journey and with their healthcare challenges, because it makes a difference.
Well, thank you. Thank you. And I highly recommend it. Look it up, BeLoved or BeLoved Guided Imagery, DrJengreen.com. And yeah, check it out. You're gonna love this guided imagery, and the affirmations are wonderful. Dr. Green, thank you so much for joining me.
Oh, thank you for having me, Karolyn.
Well, that wraps up this episode of 5 to Thrive Live. Once again, I'd like to thank our sponsors, ProThriver's Wellness Sleep Formula, Cetria Glutathione, the Superior Glutathione to support liver and immune health, Cognizant Citicoline to help enhance memory, focus, and attention, and Dr. Ohhira's award-winning shelf-stable probiotic. Well, this has been a great show. May you experience joy, laughter, and love. It's time to thrive, everyone. Have a great night.